Welcome back to Good Morning Oakcrest. I'm your host, Chris Tatus. While many of you may be familiar with heart disease, many of you may not be familiar that dental work can actually associate itself with heart disease, as well as many other bodily functions that can actually tell how your health is doing just by looking at your teeth. Now, the two gentlemen that I have today on my show may not be somebody that you're used to seeing, but we're here today to talk a little bit more about the correlation between your general health as well as your dental health. Today joining me on the show is Dr. Craig Snyder and Dr. Peter Farzin. Gentlemen, welcome to the show.
Thanks for having us.
Now, we're talking today about how your general health can be not only affected, but also, in a sense, predicted through your dental work, and how things can appear on your dental work that can almost tell you any conditions that you may be experiencing or things of that nature. When did this first come to light that we actually saw this kind of correlation between them?
I'm going to defer to Dr.
Oh, here I am. Okay.
Because he has he's a periodontist, he's a specialist, well-versed in a lot of those situations where bacteria do play a part in our mouths. We have, hundreds of different kinds of bacteria in our mouth, some good, some bad, and I don't know exactly when a lot of this came about, so I'm going to defer to him.
Well, the correlation's not new. I mean, it's been around for a while. We had a symposium back in 1998 where we kind of put some of these articles together, and we found out that there was an increase in stroke and myocardial infarction or heart attack, complications to diabetes, complications to osteoporosis, and just because you have gum problems doesn't mean you're going to have these other problems, but it does increase the incidence 5 to 7-fold for having some of these other problems. And the way that this was discovered was people would come in with like faulty valves, and then they culture these valves, and they found oral pathogens or bad types of bacteria in our mouth. We found those in the heart valves. So that kind of allowed for further investigation. And so if we can make the mouth a little bit healthier, then you can reduce your risk for heart attack, stroke, and so on, some of those other things I talked about.
Okay. So, I mean, with these different conditions, is it all, are you seeing different, can you almost tell the difference between the different medical conditions that may be associated or may be exacerbated by the different dental procedures and bacteria and things like that? I mean, is it different bacteria for each type, like a stroke or a heart attack or heart conditions, things like that?
No, it's really across the board. I mean, if you're not diabetic, obviously you're not going to have complications to diabetes. If you don't have osteoporosis, you're not going to have complications for osteoporosis. But it really comes down to having specific types of bacteria in your mouth. Everybody has bacteria in your mouth. A clean bacteria has about a clean mouth has about 1 billion bacteria. So, once it gets a little bit dirtier, you start to see inflammation in your gums bleed a little bit. Those are signs that you look to say, hey, something's not quite right in here, and then you need to come in and see a periodontist or a dentist, and once it gets cleaned up, then it's going to reduce some of those risk factors.
Now, question for either of you. I mean, is it possible that, keeping a clean mouth is going to actually help with your heart, or is it simply that the bacteria or not having a clean mouth just makes things worse?
I think it's twofold. I think part of it is, yes, you're reducing your risk, but another part is that when you have inflamed gums and those bad types of bacteria in your mouth, it really taxes your immune system. So you have your body trying to compensate for problems in your mouth. But the difference between your mouth and maybe something on your skin, if you have an infection on your skin, you take an antibiotic or you put an antibiotic cream on it and it heals up. In your mouth, there are little niches in your mouth where these bad types of bacteria can grow. We call them anaerobic bacteria. Those are bacteria that don't breathe oxygen. They get down in there, and so even if you take antibiotics and then you're like, oh, it feels better, it does feel better for maybe a month or two, but since those little niches are in there, the bacteria just come right back. And so the only way you can really deal with a problem like that is removing some of the harmful bacteria, because they basically get hard under your gum. We have to go in there and remove it, or sometimes we have to change the environment, actually cut the gums, reshape some of the jawbone. Not that everybody needs that, but that's an extreme, something extreme that somebody might need, but just to get it healthy again. And so then once you deal with those inflammatory causes, then the patient feels better. Oh, you know what? I feel better, doctor. It just feels a lot better right now.
Now, besides actual gums, I mean, can you see indicators on the actual dental or the teeth surfaces that can actually indicate that there is some kind of condition as well?
You know, I mean, there are things that we look for.
Right.
Again, I mentioned inflammation. There's also something called, we call it calculus. It's actually, layman's term is tartar. So you see this hard crystalline buildup around your teeth. And what that is it's plaque, which is soft. That's what, when you brush your teeth every day, this plaque builds up. You brush it, and you can remove it. Well, if the plaque sticks around too long, then it gets hard. So the salts in your saliva kind of combine with that soft plaque, and it gets hard. And it doesn't matter how much you brush it, it sticks around. And that's actually an antigen or a foreign body. Your body doesn't like it.
Right.
So that's where, once you remove that material, then it gets healthy. That's the first line of defense. That's the first thing. That's why people come in every 3 to 6 months just for a regular cleaning.
Now, for either of you, when you look at a population like Oakcrest, do you see people who are taking good care of their teeth? I mean, I know you're our general dentist here at Oakcrest. Is there something that our residents need to do specifically that can help them with this kind of condition, or is this something where it's just a general across the board, all ages, all genders, all races can kind of do to actually make themselves better in this sense?
You know, that's a good question, and it really does go across the board. You know, here at Oakcrest we have a pretty diverse population, and the residents come from a history of all kinds of different dentistry. You know, this generation almost are like pioneers in a sense, that way back when teeth were taken out, made dentures, and everyone just dealt with it. This generation had so much going for them in the way of modernizing dentistry. Dentistry is a pretty young portion of medicine, so to speak. And what I see with a lot of these residents is they've had very good dental care. You know, they tell me stories that their parents were too poor to take them to the dentist during the Depression, or 5 cents for a filling. And yet some of these people still were able to get some good dentistry done. And some of their health is also based on their bacterial mixture. There are some patients that brush and brush and brush. No matter what happens, they still end up with some decay, or they end up with some gum disease. So in answering your question, it is kind of across the board. Obviously, the older the patient, the more likely they may have some systemic, meaning other bodily ailments that come from gum issues in their mouth. But again, there's a whole host of different levels of dental health within most communities.
Now, one thing that I know that our residents probably are more likely to have to deal with that you won't see outside of the senior population is work with false teeth. I mean, do you still see the same conditions and the same ailments popping up when it comes to the correlation between heart disease and dental work? Do you see that with dentures and false teeth?
No, I mean, if you don't have teeth, you're not going to have those problems.
Right.
You have other kinds of problems, but they're not going to affect your heart. So once you lose all the teeth in your mouth is actually healthier. Not that you want to go without teeth, because you obviously need the teeth.
We're not pushing for people to just start yanking them out on their own at home.
I would say that once you have a denture in your mouth, there are other issues involved. Mostly it's like just leaving the denture in too long. You can get kind of fungus buildup under your prosthesis. And you know, that's easily remedied. I mean, you take it out, a rinse you can use, and it feels better. The other thing is, if you've had a denture for a long period of time, and somebody who's had a denture for 20 or 30 years can attest to this, is that the bone actually does shrink up. So you have a jawbone when your tooth comes out, and over long periods of time of wearing a denture, that bone kind of shrinks up more and more and more. So if you've seen somebody who's had a denture for a long time, they take the dentures out, it looks like there's not a really lot in between those sites.
Okay.
And so for patients like that, either they can still live with the denture, or there's a way we can actually stabilize the denture by putting titanium screws in the jaw, and then that would support the denture. It not only supports the denture, but it preserves their ridge that they have left, or the amount of bone there, because the actual dental implant will keep the bone stimulated and prevent it from breaking down.
Definitely. Now, one other thing that our residents might deal with that you may also see in other populations, but is probably more prominent here, is medication. Doing some research, we know that, dry mouth is a very big issue when it comes to your teeth. So what does dry mouth and medication play into dental health?
Again, another great point. Just in the natural aging process, things start drying up. We have less saliva flow. We might have lower tear flow. And when you start throwing in medications that are very vital and very important, those medications also dry up mouths. And saliva is kind of like one of the first defenses against gum problems or even decay, because there are materials in your saliva that can fight those particular germs. So when your salivary flow decreases, your chance of getting decay increases dramatically.
Okay.
And again, that's something that you see, unfortunately, mostly in the elderly population, but even younger patients that are on medications have a dry mouth, and they again have a higher incidence of decay, which is difficult because typically the decay is going to start on the root surface of the tooth, not so much on the enamel, but maybe an elderly patient's had some gum recession, the root's exposed, that starts to decay because of the dry mouth. And
so we almost look, I'm sorry, I didn't mean to interrupt, but are we almost looking at like the decay starting under the gum line?
Either under the gum line or right at the gum line. And that becomes a very, very frustrating procedure for me to do because there's no guarantee it's going to work. The bonding material is not made to bond to the root. It's made to bond to enamel, so the filling may not hold as well. And then patients may take care of it, the filling may go in, but they may get decay around the filling again. So the best thing to do is patients with dry mouths, a couple of things. Obviously drink lots of water. Most important time to brush your teeth is before you go to bed. And then to try to avoid lots of, sugary, sweet things. Sometimes patients will say, well, when I'm done with dinner, I go by and grab a mint on the way out from the dining room. Well, sucking on a mint just increases that amount of sugar that's exposing itself to your teeth. So it's, the joke I make is, it's better to drink a gallon of soda all at once than to drink a 12-ounce soda and nurse it all day, because you're continually bathing your mouth with sugars. So again, I'm not saying don't have sugar or don't, that you need to drastically change your diet, but the amount of exposure is really what can be dangerous.
Recently, I was reading, the one that amazed me was orange juice and a lot of citrus drinks. I was amazed to find out that, it's orange juice, something that, you've been told from growing up that all that vitamin C, it's great to have, but that citrus can actually cause pretty bad damage to your teeth as well. When you look at something like dietary changes, I mean, really, you're saying that we don't need huge dietary drastic changes. What if you're somebody who can't give up these things, who for their whole life has enjoyed that mint after dinner or has enjoyed a glass of orange juice in the morning? Are there any tips that you can give that can kind of help alleviate the stress that it's putting on the teeth?
A couple of things. The acid point that you bring up is very, very good. I'd like to throw a little joiner on that is, so people switch, let's say, from sugared sodas to diet soda. There again, you're running into acidic materials. So now we're finding patients say, well, I don't drink soda, sweetened sodas, I drink diet soda. But again, that carbonic acid in there can also affect decay rates. One of the things to do would be to drink water maybe after you've had the citrus or the sugar or the carbonated soda. You don't necessarily want to brush right afterwards. Let's say if you drank some orange juice, I'm going to go brush my teeth. Sometimes there's a thought that you're actually burnishing and rubbing some of the acidic stuff back into the root surface.
Okay.
So sometimes it's a suggestion to wait. And the other thing that we recommend sometimes is whenever you're using a toothpaste, one, make sure it's got fluoride in it. Fluoride's considered one of the greatest public health discoveries of the 20th century because it cut down on, by fluoridating water, it's cut down on decay rates so much. So fluoride's exceedingly safe as long as it's used in the right concentration. And some more susceptible residents will even bump it up a little bit and suggest using a level of fluoride that's prescription level, so that they get kind of more bang for their buck.
Now, when we're talking about cleaning and keeping our mouths nice and clean, is there anything known as too clean? Now, I know you both mentioned that there's bacteria in your mouth that, you know, are necessary to everyday life. You know, they help break down food. They actually help kill off some of the bad bacteria. So is there something known as too much cleaning?
There's no such thing as too much cleaning. It depends on how you're cleaning.
Okay.
So if you use a soft bristle toothbrush, you know, regular dental floss, you use a toothpaste that's not highly abrasive, and then it's not going to be an issue for you. But if you get compulsive with anything, you know, you can do damage. You know, you use an abrasive toothbrush, you use an abrasive toothpaste, then you can cause problems for yourself. You can increase sensitivity, you can actually start to wear through the tooth structure. If you have thin gum tissue, you can actually wear away some of the gum tissue. So, you know, I think a good rule to use is, you know, everything in moderation. You know, if you're compulsively brushing your teeth, not necessary. I mean, you know, it's a little bit of overkill. Right. When you brush your teeth, you're removing a layer of bacteria that kind of cakes up around your tooth. And once you remove it, it takes time for that to come back. It's not going to come back in an hour. So, you know, 3 times a day is great, even twice a day, in the morning and before bed. Now, if you've had a lot of dental work done, you might want to do it a little bit more often. If you have a lot of crowns in your mouth, they're a little harder to keep clean, so you want to brush a little more often. But brushing is always good as long as it's done correctly.
Okay, well, getting back to talking a little bit more about the correlation between your general health and your dental health. Are there any other major risk factors that you each have seen, whether it be, you know, I know we said that, you know, age and those things can play a part in it, but is there anything outside of age that can kind of affect your dental health? Like, have you seen a particular race, a particular economic area that kind of says, you know, you've seen more problems in?
I mean, I think ultimately everybody's a little bit different.
Right.
It really has to do with genetics. There are people who come in and say, Doc, I haven't been to the dentist in 20 years. And they come in and I look in their mouth and there's nothing there. There's no buildup. They don't have any cavities. Now that's an extreme example. But I also have people who come in every 3 months and they continually have problems. It's a constant battle. And it's really how their body deals with the bacteria in their mouth. And so as far as, you know, race goes, I mean, there are some studies that show, you know, some parts of the world will show certain things. But again, that comes down to genetics again. Right. They have certain genes that say they're not able to cope with specific bacteria.
I feel like that almost could also have to do with, you know, the location of that particular set of people as well. You know, I mean, you may not see, you know, as good a dental care in other countries that you're going to see in the United States just because it's not available or it's not financially possible for them to do that.
Yeah, I think the key is routine care. You know, it's kind of like your car. You go in every so often, you make sure everything's okay, you don't have big problems. You stay away long enough, you got big problems. It's very similar. Right,
and for your mouth, there's not really a check engine light for them to, you know,
unfortunately, there's not. No,
keep track of things. So, all right. Well, gentlemen, before we wrap up here today, is there any big news that we've seen come out of the dental world? I know, you know, a few years ago we had you both on the show and we were talking about the great advances that we've seen in dental implants. Are there any big new inventions, anything that the dental world, or are we kind of maintaining the old traditions?
I mean, our field is always changing. There have been new designs in dental implants, but dental implants were already very successful. So we had a 96% success rate. You know, now we have a 97% success. This is very successful. There have been some new advances in bone grafting. So some patients don't have enough bone. Maybe if you didn't have enough bone at some point, maybe now because we have some newer materials that we can use, some growth, we've been able to kind of culture growth factors that tell the body to grow bone. We grow the bone, then we come back and put implants in.
That's great to hear. All right, one last question before we wrap up. Now, this weekend, the Baltimore Ravens facing off against the Houston Texans. So I have to ask, if by some chance some football players might be watching this show.
Yeah. Oh, it's a mortal.
What is some teeth care recommendations for the gentlemen just, you know, slamming into each other all weekend long?
I think they all wear mouthpieces.
Mouthpieces.
Mouth guards, definitely.
And I think they have some anti-concussive mouth guards that they wear now, so keep their jaw in the right position. But in the words of Al Davis, just win, baby. Just win, right?